to avoid depression, no matter what the client gives you, you go with it. Okay? You roll with the resistance in terms of like motivational interviewing. So what happens? I go to a VA hospital. I consult in a lot of psychiatric facilities. So what's my function at these psychiatric facilities? What am I getting paid to do? Okay? It's essentially two purposes. One is reassurance, because they're going to pick out the most difficult, challenging client, family group that they have and throw me in the room. And the second job I get paid for is entertaining value. Shit, more than the top 10. Look at that, huh? Look at the, I mean, how much you think they're paying him? I should be in that room. What the hell's going on, okay? So they pick out the most difficult group for me at the VA. I walk in. I don't even have a moment to introduce myself. Everyone's behind the mirror. These guys verbally assault me. The system sucks. They're out to screw you. No one gives a goddamn. And you can hear the people behind the mirror going, ha, 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 ha. Now put yourself in my shoes. What would you do? Right? Remember, I'm a cognitive behavior therapist who refuses to get depressed. So what do I say to them? Woo, what a relief. You know, before I walked in this room, they told me that each and every one of you guys were emotional dead wood. The fact that you could attack a stranger out of nowhere is indeed impressive. You hang on to that anger. You give that up, you are nothing. See, they're not going to give up the anger anyway and the indignation, right? Now what I'm trying to do is bring it under instructional control. You hang on to that anger. Now, you ready for this? Turns out that the system is much worse than you're making out. You've only hit the tip of the iceberg. I worked with female adolescent offenders for 8 years. It is the most humbling, therapeutic experience you could have. You have any illusion of competence as a psychotherapist, I invite you to work with female adolescent offenders. Girl comes in, she sits down, she will not talk to me. Now, I feel I'm a really good therapist, but if you don't talk to me, Now, I'm a cognitive behavior therapist. What would I do? I mean, if you were in my shoes, what would you do? I go, woo, what a relief. You wouldn't believe them, a girl sitting in that chair. All they do is talk, 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 talk. The only time I get quiet all day long is when I see you. I look forward to our sessions. Not only that, they say that some of the most productive work in this kind of area occurs during silences. I just had no idea we're going to be this effective this early. Look, I'm a cognitive behavior therapist. There is nothing that you can do in therapy that I can't reframe as buying into treatment, okay? You want to yell at me, you don't want to yell at me. You want to talk to me, you don't want to talk. It makes no difference. There is nothing that can get me depressed. If I am not the right person, if this is not the right time, okay? If I am missing something. So take this girl. This is really interesting in terms of challenging patients. What's contributing to her reticence? Her non-participation. Turns out that she was sexually abused for multiple years by a stepfather. The stepfather told her that if she ever shares this with anyone, something terrible would happen. This young girl has a younger brother. The stepfather tells her that if she ever shares this with anyone, the following will occur to her younger brother. He takes her pet dog and beheads it in front of her. Okay? All of a sudden, her silence speaks tons. Okay? So how do we understand the functional value of their anger? How do you understand the functional motivational value of their silence? Unfortunately, this girl was in a residential program while I was a consultant, and the residential program decided to get a large pet dog. And I arranged for her to be in charge of caring for the pet dog. And all of my therapy was done in walking and caring for the dog with her. Because she had to figure out, when does the dog have certain needs? When does the dog have to go out? When does the dog need affection? What are the kinds of warning signs? And by analogy, we could then talk about the degree to which she has those same needs. How do we ensure that her younger brother is safe? How do we address the issue of the stepfather's victimization? Okay? This all has to do with the nature of the therapeutic relationship and how you're going to tailor it in a developmental or culturally sensitive fashion.